Last summer looked like a great summer for Katie. She was in the middle of a healthy pregnancy, and then things took a really scary turn. She developed preeclampsia, which is a life-threatening condition, so she was admitted to Brigham and Women's Hospital in Boston. They put her on bed rest, but it went from bad to worse. Her kidneys were failing. She was developing neurological problems. Her liver started to fail. And that's what it came down to. She had to deliver that baby to save her life and to save his life. At only 26 weeks and 2 days, Peter was born weighing 1 pound, 14 ounces. Peter spent 173 days in the neonatal intensive care unit. He was intubated for 3 months. He had several chest tubes, and he also had to have surgery to fix a damaged lung. Peter's stay in the hospital cost nearly $3 million. $3 million for this little baby. Now, thankfully, Peter was born after the ACA had gone into effect, so the insurance that Katie and her wife had couldn't say, oh, your little baby is 5 days old and we're sorry, he's already used up all the insurance he will ever get under our plan. And Katie says, even for somebody with insurance, Medicaid has been a huge savior for us. When Peter came home from the hospital, he was on oxygen 24/7, and he needed a gastric feeding tube. Their insurance didn't cover these products, and even though these were things that were necessary to keep Peter alive and things that are not cheap, but Medicaid does cover the feeding tubes and the oxygen equipment. Medicaid picked up the majority of Peter's other bills. Now, Katie also tells me that Peter sees anywhere from 2 to 8 different doctors a month to keep tabs on all of his different health care needs. Medicaid covers the co-pays on these visits. Today, Peter is a happy, giggling little boy who is about to celebrate his first birthday. But Katie is worried. She's told me that she's worried about Peter's future. Republicans in Congress are not only trying to knock the legs out from health insurance, they're also trying to cut Medicaid by more than $800 billion. I want to read you what she said. Peter didn't do anything wrong to have been born with chronic lung disease or to have started his life 14 weeks before most kids do. He's an amazing little boy who has fought so hard every step of the way. Now, Katie and her family are fighting this cruel health bill. You better believe they're in this fight all the way. I'm in this fight with Katie, and I hope you'll be in this fight too. We gotta fight back against 13 men who are writing health care coverage for all of America.